Hi, everyone. Welcome to another exciting episode of Equilibrium, our women's health series. I'm your host, Bria, and I'm here with Dr. Cohen. Thank you so much for being here.
Thank you for having me.
So you're an optometrist in Brooklyn. Tell me a little bit about your background. Have you always been interested in optometry?
Yes, always. So, my family's Jamaican, and my parents were both teachers, and they taught in Jamaica and the Bahamas, and we came up to the States when I was probably like 2 or 3. And early on, I just assumed it was normal that things far away were blurry. And once I started school, then it was more evident that that's not how everybody else saw. They didn't always have to move up close to see things. And I got my first pair of glasses when I was probably like 6 years old.
Oh, same.
Yeah, and I loved it. I loved going to the eye doctor because he was really nice and friendly, and he had like cartoon ties. And I just, as I got older, I thought, oh, this is fun. You get to talk to people all day and then help them see. This seems cool. And the older I got, the more I looked into it, and I saw that there was more to it. So it just became more interesting, because if it was just like doing glasses, I thought, okay, this could be boring. But there were so many other aspects to the profession that I kept pursuing it and figured like, okay, if I make it through, then I'll do this. Over the years, it's really expanded for me as far as like my passion and love for it, and the love for like bringing it to the community and educating the community. And my vision has continued to change, and I was diagnosed with keratoconus a few years back. So I've been dealing with actually managing my eye health and undergoing certain corneal surgeries in order to preserve my vision. But understanding that these eye diseases are out there and how many of them go undiagnosed, even for myself, someone who goes to the doctor, regularly, and I am an eye doctor. I think that just shows like how important it is to really make sure you're getting full scope care.
Now, tell me, what did you call it that you have to get for your eyes?
Keratoconus.
Now, what is that?
So it's the clear dome of the front of the eye is the cornea. And so it is the actual coning, or instead of it being a sphere, it's coning out and distorting vision. So for me, I would say to people, I feel like things are different for me. I didn't have like the classic case. My brother actually has the classic case, and that starts in adolescence, where there's a shift in vision. That didn't happen for me. I was just nearsighted for most of my life, but I noticed that it wasn't just blurry. Things looked weird. That was the best way I could describe it to people. And that when I was driving at that time, I was living in Philadelphia, and I was still driving. I noticed that driving at night was getting really difficult in a new way, where I just wasn't making things out, not just like slightly, like things just were, it's almost if I try to describe it to people, like imagine smearing oil on a glass and trying to see through that, or that things look tilted. It's an extreme astigmatism. It really.
Okay, I was going to say it sounds similar to an astigmatism.
Yeah, but in its very extreme form of it.
Wow.
So your average, like say numerically, your average stigmatic power might be 0.5 to maybe 3.5 being pretty high. For me, I'm probably closer to like 7.
Wow.
Yeah.
Okay.
So
okay.
that greatly distorts the vision. And with the procedures I've undergone, it's really tried to make it more like a sphere. So flattening out my cone by doing like a transplant of tissue. And I'm actually in a research study right now. So as soon as that clears up, then I get to do another fun set of procedures, one being cross-linking, which like slows down the progression just in order to preserve my vision for years to come.
Wow.
So, yeah.
Oh my gosh, you're starting off. Oh my goodness. Okay. Do you think that's hereditary? Because you mentioned your brother has it as well.
Well, I'm trying to, he and I might possibly be in another study because they're still
Okay.
looking into it. It does tend to run in families. It's just not fully understood yet. And it's still being researched, but there is highly likely a genetic link.
Wow. I feel like when I think of like eye doctors I've had before in the past, I never think about their eyes and what they're going through.
Most eye doctors do not see well. I'm gonna tell you that right now. Most eye doctors have, like in class, amongst all my now colleagues, but my classmates, we always knew who we wanted to practice. We had to practice on each other before you get tested to see patients in clinic in school. You practice with your classmates, and you always pick who has this condition, so I can see what this looks like. Let me test this out and see if I can figure out how to solve it and stuff. So unfortunately, and this was before I was diagnosed, it just was really hard to figure out my prescription, because there's a way to look for a prescription where you shine the light at people. It's called a refraction. And we didn't know what it was. I don't know how we didn't like put it together, but nobody wanted to refract me. They're like, there's something wrong with your eyes. Like,
Oh, weird.
because of the distortion with when you look for the light reflex, it flows in a certain pattern. But when you have a really high astigmatism, but especially keratoconus, one of the classic signs of keratoconus that their light reflex scatters, what we call scissoring. So it's all over the place and you can't narrow down the prescription. So if we're practicing and if they're getting tested, I used to feel so badly for them. I was like, I'll just read the 20/20. You don't have to get it right, because you fail it, you fail the practical, and you memorize the chart, the classic chart. So I'll be like, I got you, TTBC, I got it, guys, don't worry. But yeah, everybody had some kind of condition, and usually just pick who you want to practice on.
Wow, I would never think about that. I'm all in your business about this. Do you have to wear different types of glasses?
Well, actually, okay, so one, I'm a bad patient.
Uh-oh.
Let's I actually am supposed to be in hard contacts. They're custom made for my eyes, just because when you have a higher prescription or one like mine, the regular soft disposable lenses just won't fit my eye. And my friend, who is also one of my doctors, made these specially for me, and he designed them because he designs these type of lenses. And I'm really supposed to have them on, and he'll laugh, but he kind of knows who he's dealing with. I just don't like wearing them. I don't like wearing contacts. I see amazingly well when I wear them. I just don't like it. And the upside is, since having done these set of procedures over the last year, while my left eye is still pretty blurry, my right eye has improved so much that sometimes I can go without glasses, because I'm able to see well enough to function with the right eye. Of course, I have lots of glasses because it does help sometimes, like with screens and stuff. Again, because that scattering of light happens. So trying to focus, doing charts, that was one of the reasons I actually went and called my friend and said, I think something's wrong. I was doing charts and I just couldn't get through my charts. I was getting these massive headaches because it just wasn't keeping in focus. But the glasses help with that. So I have on my blue light glasses. I'm speaking with you on the screen. Good.
It's a good segue into my next question about blue light glasses. So I have in my contacts right now, but throughout the day they get super dry. I don't think my contacts can't have blue light blocking capability, can they?
Actually, there are some lenses out on the market now with blue light. But yes, that's possible.
Okay. Now, so I also wear glasses that have the blue light blocking in them. Do you have any other suggestions? Like, say, like I have a really long work day on the computer. Do you have any other suggestions besides blue light that can help, like with tired eyes or anything like that?
Well, a few things. We're all on the screens way too much, and our blink rate is reduced once we're on the screen. So that's why your eyes are drying out so much, right? And we really have to hold ourselves accountable, because now we're working all day, and then for fun, we're on our phone. And so people ask that all the time. I'm like, your real best way to improve that situation is to take legitimate breaks from the screen. And so sometimes we say breaking, that means we go to our phone, but that's just another screen. And so I'm like, get up, walk away, take a walk your dog, hydrate, do some other things. And I mean, honestly, like even when I'm in Pilates, like we talk about it in our group, you know, your whole posture changes once you've been at the desk all day. So it's really good for the whole system to get up and take that break, stretch, hydrate. We aren't made to be sedentary like this and you know, hunched into this one position. Our eye muscles aren't built to really converge and stay focused at near for so long. And so I always say, would you want to be in a plank all day? You're basically making your eyes plank all day. Give them a break.
Ooh,
you know,
not a plank all day. Ooh.
Right. Slightly give them a break. Why are we
Yeah, they need a break.
Eyes?
Yeah. Okay. Sounds good. I have a few questions that people have, you know, I've just kind of, before we had this interview, I asked them what's something that you'd love to know.
Right.
So talk to me about, you know, the annual eye exam. Why are they so important? And, you know, if you decide to skip one, what are some of the risks that are associated with that?
Well, an annual eye exam, I think any preventative care exam is important because it prevents more serious conditions, right? With an eye exam, it should always be a little bit more than a refraction, which we talked about, right? Which is finding the prescription for your glasses or contacts, right? People want to do that and they rush out, especially, oh, I'm working from home, I got to get back to my meeting. And I tell everyone, I'm like, okay, that's cool, but you know, you should definitely get dilated and make sure that we're checking XYZ as well. Aside from reading the chart and finding that prescription, you should be getting your eye pressure checked, right? That's one of our first screening tests for glaucoma. Doing the dilation is really opening up a door so that we can check the health of the back of the eyes. There are so many things systemically that show up in the eyes, blood pressure, cholesterol, diabetes, autoimmune diseases, thyroid issues, STDs. There's so many things that show up in the eyes that, you know, that's the first line of defense. That's how you can say, hey, let's talk about this. Have you been experiencing this? This might be a reason for that, right? And by skipping that, you really are missing an opportunity to catch something sooner. This is particularly important if you know that certain diseases run in the family, right? January is Glaucoma Awareness Month, and that's a big one because I believe more than half of the people who have glaucoma aren't even aware that they have it, right? And it's really devastating. A lot of communities, but particularly the Black and Brown communities, which are 5 times more likely to go blind from glaucoma. So glaucoma deals with the optic nerve, which is basically like the extension cord to the brain. We have an optic nerve in each of our eyes, and it goes to the brain. That plugs in the information to the brain so that we can see. And there's like a plumbing network surrounding that cord that when it goes out of whack, that fluid in the back of your eyes builds up and it compresses the nerve and basically kills some of that nerve tissue, right? We can't get that tissue back, right? And it's something that you wouldn't be able to tell me. You're not going to come in and say, hey, doc, I need some glasses and something, you know, this is happening in my vision. You really wouldn't be able to tell me until it's too late, right?
Okay.
Because it affects your side vision first, your peripheral vision, and then slowly creeps in and affects your central vision. And yes, it typically does affect people 50 and older, but I've diagnosed plenty of 20, 30, and 40-year-olds. I feel that 40 should be the age that we really use in our education of glaucoma, because I find that early signs of glaucoma really show in the early 40s, especially when it's, hey, my mom has this, or my aunt or my grandparent had this. We have this idea that, oh, this grandparent had it and they're older age and they went blind. Well, they went blind at that age, but they probably had it for 20, 30 years and it went undiagnosed, right?
So what are some,
Yeah.
What are some signs of glaucoma?
Well, that's the thing. It's a silent thief of sight. There really aren't many signs, right? In extreme cases, you might have some eye pain. you might notice a change in vision, but again, that would be in the later stage of the disease where you've already lost a good proportion of your vision. So that, going back to your question, that's why an eye exam is important, because these are the things that we check for ahead of there being a detrimental loss of vision, you know?
Now I'm thinking of my most recent eye exam, and I didn't get dilation. Is that a problem? Should you be getting dilated at every single exam?
In my opinion, yes.
Okay.
A comprehensive eye exam is a dilated eye exam, right? And then, like I said, if you know that, another important part is asking the right questions in your family, because a lot of times we take it for granted, like, oh, so-and-so, I think they have something wrong with their vision, but I don't really know what it is. You need to know, like, you know, ask your parents, ask your siblings, ask, you know, grandparents, you know, what was it that caused this change in so-and-so's vision? Because that then is another sign that, okay, maybe I need to not only get dilated, but I should get this screening test done, because there is this history in my family. We don't want to, in the spirit of adulting,
So much.
yeah, I find that we are very hesitant to do the grown-up mature thing. Okay. I find that if it's a hot pair of shoes, or, you know, a really jazzy manicure or something we saw, right, that we saw online, bam, take all my money. But when it's about maybe financial literacy, or taking care of my health, or making sure I have property insurance and all of these other things, like, I'm good. Worry about that later.
Right.
And it's really bad. That little $50 you could have done for a screening would probably save you so much in the long run, as far as your overall health. Like, I'm always tickled by patients who are like, oh, no, I don't want to pay for that. I'm okay. I'll just go. And I'm like, okay, because I don't
see you in 5 years.
Right, exactly. I never push things on people, but I'm tickled because I'm just thinking, like, now, if this was like a meal you saw on Instagram and it was Instagram worthy, you would give them all your dollars for this meal that you're going to take 2 bites of, that is, you know, has gold flecks in it or something. But to do your eye health screening, too much for you.
Miss me. Like, I'll pass. Yeah.
Yeah.
Man, I've been definitely guilty of passing on some things where I should have definitely gotten. Okay, so we talked a little bit about the different things that you check during the exams, but at your practice, at Pearl Vision, right, you perform diabetic exams. Could you tell us, like, what the exam is like and the sort of impact that diabetes can have on your eye health?
Right. Yes. So I co-own a Provision franchise office, and my goal really was to merge, like, commercial practice with the glasses, and you come in and do that, and also the importance of doing more thorough eye health screenings. So just what we talked about, you do a dilated eye exam, and then once you're dilated, that pupil, that door is open widely so that we can see into the back of the eyes. But I can look in there with magnifying lenses, but there are certain screening tests. Think of it almost as types of MRIs of the eye that will go through all the layers of the back of the eye, because the retina, the nerve tissue, the sensory nerve tissue in the back, there's several layers. And so maybe I'm not seeing it as fully myself, that's going to pick that up. We just talked about glaucoma. The nerve itself, you're looking at the size and shape of the nerve, but glaucoma doesn't look the same for each person. Sometimes somebody's nerves look a little normal and they're still losing vision, right? That's why it's a silent thief of sight. It's really tricky. So you want to do that scan, because then that allows you to see, hey, this looked normal, but something is changing here. You know, you're going to look at the cells of the nerve and see, okay, we're losing some here. Why? And how does this correspond to vision? So you might then have them do a vision test. But with diabetes is actually the #1 cause of blindness in the US right now for adults ages 20 to 74. And it's on the rise with childhood obesity and the rise in diabetes that we're seeing in kids, right? With that, really, everything connects. So all the blood vessels from your body, they empty out into the eyes. And when that blood sugar is too high, those blood vessels, they're basically stretched out too much because the blood is now thick. There's too much sugar in there. It makes the blood thick. And that starts to leak out or hemorrhage in the eye. So I've diagnosed people where I say, hey, I'm pretty sure you're diabetic. You need to see your primary care doctor. Say, oh, no, I'm not. Okay. Have you have increased thirst, increased urination? Have you had fluctuations in your vision? These are all signs of diabetes, and I'm seeing bleeding in your eye that corresponds to diabetic retinopathy. So when the sugar stays too high for too long, you might have too much hemorrhaging that then destroys the nerve tissue in the back of the eye. It destroys the retina, and you can't get that back, right? There can be surgical intervention with an ophthalmologist, who would be the surgeon, to work on that. But sometimes it's gone on for too long, or the damage is too great.
Wow. So then that's when you go blind completely.
Yeah.
Now, when you say there's bleeding in the eye, is that something that you can see like by looking at someone's eye, just like natural? Okay. So it's like in the back.
Yeah, that's why you do the dilation, because that person might say to you, my vision seems off, it seems blurry. Or if when the sugar is fluctuating, I have these moments where everything's blurry and then I'm fine, because that's why they're not getting checked. It's blurry for like 10, 15 minutes and then they're fine, right? But that might be that the sugar went up so high and then came back down. But if that's happening more often, it could lead to a stroke, right? And a stroke appears that way. A stroke, a TI, a transient ischemic attack, is one in which the whole vision kind of goes out for a bit and comes back. And that's the early warning sign of basically a milder stroke, right? Because it doesn't leave, any arm tingling, doesn't leave any facial drooping. It's just this visual change. And that's linked to a lot of diabetics as well. And they let that carry on until they have a full-blown stroke and then have to be hospitalized.
Oh my goodness. I never knew all of this I never knew that the eyes could tell you so much about your body.
Oh, yes.
Oh my God. Okay. At your practice, what would you say is the number one thing that you're diagnosing from your patients?
Honestly, over the last almost 2 years, I've been dealing with a lot of what we call binocular vision issues. And it's really fascinating to me, because it just shows how important it is for children to be screened properly when they're in school and when they're young. We take it for granted that, oh, they're young, they're fine. But I said that for me as a child, I never saw clearly, but that was normal for me, right? Because that's how I always saw. So I find parents will say, oh, I think they're fine. And I'm like, well, how would you know? They're not going to be able to tell you because that's how they've always seen. Right. So no, get an eye exam. But the eyes together, I always call them two dance partners, right? So they should be looking left, right, up and down together. When we're on the screen, I mentioned they converge, they come together, right? To keep things in focus. When we look at distance, they diverge. But sometimes they're not on the same rhythm. They're not on the same beat. And so they're supposed to be coming into focus, but one eye is out a little bit or can't stay in. And so that's what we call a binocular vision issue. That would be someone who doesn't have the classic colloquial lazy eye, right? Or strabismus. That's someone whose eye muscles may be just a little weak and you don't see it within, observing them straight on. But when they have to focus, they're working from home and they're now on the screen for hours. I get a lot of people who say to me, I can't keep things in focus. I'm getting these really bad headaches across my frontal lobe or on my temples. Things come in and out. I feel like I have to refocus all the time. And then I'll say, okay, well, tell me this, do you have to reread things? Oh, I always have had to reread things because I have ADD and I've been on medication for ADD since I was a kid, and I just don't keep focus. And classic. I'm like, is it that you don't keep focus, or is it that you're not seeing it clearly? And so you're constantly trying to refocus your vision. And so a lot of people, I've been using what we call prism lenses, which would bring the image to where the eye prefers to relax itself. And that allows them not to have to work so hard to keep focus up close. It diminishes a lot of headaches and fatigue. It just improves their overall state of being, depending on the severity. So I've been diagnosing a lot of binocular vision issues, just the whole advent of working from home and the increased screen time. That's been a big one for me.
Oh no, that's, I mean, another drawback of COVID. And well, I mean, I personally love working from home, but that's another drawback from that too.
Yeah.
Oh gosh. So one of my last questions, one of them, what advice do you have for someone who has poor eyesight and wants to improve naturally?
I mean, I think we've covered like getting an annual eye exam. That's important. Making sure you're getting checked is awesome. I find that a lot of people will say, oh, well, I know you gave me a prescription for glasses, but I feel like it's making the vision worse. Because when I take them off now, everything's blurry. I roll and yawn.
That's what my husband says. Is that not true?
I roll and yawn because you couldn't see when you walked in here. And those glasses are helping you to see. And yeah, if you take it off, it's blurry because you just went from seeing clearly to not seeing clearly.
Yeah.
So yeah, that's one of them. You know, if you got prescribed glasses or contacts and it's helping you to see better, I don't know, wear them. That would be great.
That's an option.
So getting an eye exam, wearing the correction you were given, that's great. Of course, exercising, eating healthily, eating colorful fruits and veggies, staying hydrated. You know, we just named several systemic diseases that cause eye changes, right? So if we start at the forefront of making sure we're eating less processed foods and we're really diversifying our diet and making sure that we're taking care of our systemic health, then ultimately you will be taking care of your ocular health.
Got it. Well, thank you. That's a great advice. I do want to know, like if someone is interested in becoming an optometrist like yourself, how would they do that? What's the process? How did you become who you are?
That's a great question because I had no idea. I thought it was something you could major in college. And I went to my college advisor, like, so where is the optometry like major? I don't understand. She just looked there, she's like, no. So basically you would need a 4-year bachelor's degree, and then you apply to optometry school. In my day, there were less than 20 schools, but I think there were up to like 25 schools in the country now. But you would apply for a doctoral program. So it's another 4 years and earn your doctorate of optometry. You can do a residency after optometry if you want to specialize or maybe go into academia or just for your own knowledge, you can do a residency. It's not mandatory. And then, then you would be a licensed optometrist.
Wow. Okay. Well, thank you. I know you were just named 2020's most influential woman in optical by Vision Today, right?
Vision Monday magazine. Yes.
Well, congratulations.
Thank you.
Tell people if someone is interested in, asking more questions or finding you on Instagram, go ahead and tell us how to find you. What's your handle?
Sure. So my IG handle is Dr. Camille F. Cohen Optometry. So DrCamilleFCohen Optometry OPTOMETRY. Okay. Yeah.
All right.
And I'm based here in Brooklyn, New York. So I have the ProVision franchise. It's located at 95 7th Avenue, Brooklyn, New York, 11215. And the office number is 718-230-0205.
I love it. I wish you were my doctor. Plain and simple.
Yeah, we clearly need to have some talks.
I mean, right? I haven't been dilated. No one cares about my eye health. I don't know the right questions to ask.
We're gonna get you.
No one cares about me. Well, I appreciate you.
I'm actually concerned now, but I do.
Okay. I'm gonna FaceTime you next time I go in to the doctor and you're gonna be there for me.
Yes, I will. I'll be like, excuse me, dilate her immediately.
This is a necessity, okay? Everything I learned here. Well, I appreciate you so much. Thank you for teaching us all this stuff. Get your exams, people. I will see you guys next episode. Thank you, Dr. Cohen.
Thank you so much for having me. Have a great evening.
You too.
Thanks.